Welcome to this episode of Legal Angle with Emmanuel, the law Olawale. My guest today is someone I've known since my days in college. We went to the same college, which is the College of Staten Island, City University of New York.
Mhm.
Back in the days, her name is Dr. Ene Ojile. Thank you for coming on to Legal Angle.
You're welcome. I'm excited to be here, and it's awesome to see you doing amazing things. We do go way back, college days, so I'm just happy to be here. So excited.
I'm happy to be here too because I'm glad that I'm in the company of a great person, Tujila. Could you tell our audience your educational background?
Yeah, absolutely. My name is Dr. Ene Ojile, and I went to the City University of New York, College of Staten Island, which is also where our host here and I met. It's the College of Staten Island, New York, where I studied biological sciences, and I gained my bachelor's from there. And from there, decided I wanted to go to medical school, so I went to Temple Medical School in Philadelphia, where I completed my medical degree and stayed there in their hospital system another 4 years to complete what's called a residency training, my specialty training. Um, I'm currently board certified in physical medicine and rehabilitation. And essentially, it's a specialty that deals with the medical management and rehabilitation of people that have debilitating illnesses, injuries, and things like that. And I currently live in the Atlanta metropolitan area where I have my practice called Sports Spine and Rehab Specialists. Um, and so I see a lot of these patients who are really debilitated and need rehab, medical rehab. That's what I do.
Yeah. And do you also treat COVID patients?
I do. So a big part of what I do as a frontline worker is, so COVID, you have about 20% of people who are infected will actually end up becoming really sick and need to be hospitalized, right? And sadly, out of the 20%, 2% die. But out of the 20%, a lot of people don't return back to their normal lives. So they don't, um, after they're sick in the hospital, they can't go back home because we have what we call a lot of sequelae from it, neurological, psychological, muscular. So a lot of them can't walk, can't talk, can't do the things that they used to. So they have to go from the main hospital to a rehab hospital. And so I've seen a lot of these COVID patients who did not, thankfully didn't die from it, but now have all of these debilitating illnesses. And so they need a rehab physician, which is myself, and a rehab team that includes physical therapy, occupational therapy, speech therapy, to hopefully get them back to normal lives, or as normal as possible. We don't always get back to normal, but the goal will be to get them back home, get them back to being hopefully productive and functional in society again.
Thank you. And how long have you been a medical practitioner?
I graduated medical school 2003. So technically, I can't believe it. This year would be 18 years since I've been a doctor. 18 years. And then a specialist 2007. So that would be 14 years since I've been a specialist practicing independently. So it's been a while.
Time flies, yeah. Yeah, today you'll be answering questions and educating us about the facts and myths about COVID-19 vaccines. I have questions from the audience that they've sent in, and I'm sure you'll be able to, by the end of the show, will be much more enlightened than we are right now. So my first question to you is, what are the different types of the COVID-19 vaccines available at the moment?
Okay, so in America, we have the FDA has approved two vaccines. We have the Pfizer and the Moderna vaccines, and they're called mRNA vaccines. So that's what we have in America. That's what the FDA has issued, what's called an emergency use authorization. Now, that being said, there are other types of vaccines outside of the mRNA vaccine that have been approved in other parts of the world. So like in UK, the AstraZeneca vaccine is called a DNA vaccine, and that's been approved there. Um, and then we have the traditional vaccines that are still being researched upon, kind of like the MMR vaccine or the polio vaccines. Those are all a different category of vaccines, but those are still being researched for COVID and have not yet been approved. Hopefully in the future that will happen. But in the meantime, in the US, we have approval for the mRNA vaccine.
Okay. So should people be selective as to which one they will eventually take?
No. So in the US, the options are really just really the Moderna or the Pfizer, right? And there really isn't a difference because they're both in the same category. They're both mRNA vaccines. Now, how they've been made and processed and things like that is such that their storage might be a little bit different. And the Moderna might be, they say, somewhat more concentrated in the mRNA than the Pfizer. But other than that, they're still the same category. So, either one would work just as well. You don't have to be selective about which one you get.
Okay. Are they both, do they require two doses? Both of them, either the Pfizer or the Moderna, or there's one that requires just a single dose?
No, so both of them require two doses. So the Pfizer is about 21 days, 3 weeks after the first dose, you're expected to get the second dose. And then for the Moderna, it's 4 weeks. So after the first dose, the second dose, and this is not only recommended, but kind of required that you get both doses to make sure that you're fully protected. When I say fully protected, both vaccines are about 95% effective in preventing mild to moderate COVID. So if you want to get that full 95%, then you do want to get both doses. If you only get one, then there is a possibility that you might not get that 95% effectiveness. That might drop down to, say, about 60 or 70%. So definitely, if you're getting the vaccinations, definitely get both doses.
Okay. What happens in a situation where maybe you got the first dose, you were supposed to go back for your second dose, and you did not? And let's say 3 or 4 months later, you decide to go for your second dose. What happened in a situation like that?
So definitely don't recommend that. Go for your second doses unless there are extenuating circumstances. But if it happens, you just couldn't get the second dose. What the CDC recommends is just getting that second dose whenever you can. So there technically is not an upper limit for how far you can wait. But the studies that have been done and that show that 95% efficacy is the time, again, 3 weeks with Pfizer and 4 weeks with Moderna. So you definitely would want to stick with that. But again, technically, the CDC says there really isn't like an upper limit. If you have taken the first dose 3 months later, go right ahead and get that second dose.
Okay. There are people that says that, well, since it's 95% effective, there's still the 5% chance that I could still get infected. I'm not getting it. So what do you say to people like that?
Well, that's an argument where you again, you look at probability, right? So keep in mind that even though there's a 5% chance that you could get infected with after the COVID vaccine, within that 5%, what you'll see is that the people who get COVID have much milder symptoms and a much lower chance of dying from it. So again, the argument here is, well, there's a 5% chance that you could still get COVID, but within that 5% chance, if you got the vaccination, much lower chance that you would die from COVID. So again, the recommendation is get the vaccine when it's your turn to get it. Definitely go out and get the vaccine.
So how about after you taken either the first dose or the complete dose, do you still have to wear a mask and social distance after taking all those doses?
So this is the thing. the vaccination protects you from being infected with the virus, right? But keep in mind that our bodies, our hands, our nostrils can carry the virus. You know, we're always carrying something, right? So even though you are protected from being infected, you can still carry the virus in your fingers, your nostrils. So you definitely, even after vaccination, you still wear your masks because you can be a carrier. Still social distance, still use your hand sanitizers. The vaccine is not a ticket to just, go back to, what we knew before COVID. We still want to make sure that many, many more people are vaccinated before we take up our masks and, stop social distancing and things like that. So wear your masks after the vaccine. Definitely keep wearing the masks.
So, in other words, what you're essentially saying is that even after you've been vaccinated and you're protected, you should still be socially responsible to protect others.
Absolutely. You hit the nail right on the head. Absolutely.
Yeah. So there was a report in the NBC News just this week, or possibly it could be either this week or last week, but it's a recent news that 4 people tested positive even after getting vaccinated. Some people would read that to be like, well, this thing is not effective. After the vaccine, they took the doses and they still tested positive. What do you say to people like that?
So I'm going to go a bit into a little bit of science here, right? So what happens is when you come and someone comes in contact with the vaccine and it gets into their systems, they're asymptomatic for a while. So, and that period is called the incubation period. For COVID virus, that incubation period is anywhere from 2 to 5 days up to 14 weeks. The average being about 2 to 5 days. So what has happened in a lot of these people that have gotten the vaccination and then tested positive is more than likely they already had the virus and they're already incubating, meaning that the virus is already kind of cooking in their system, but they didn't quite have symptoms yet. So the vaccination did not cause the positive COVID for sure. And keep in mind, the vaccine is preventative. It's not a treatment. So if you already had the virus in your system, the vaccine is not going to treat what's already there. So again, so don't be concerned that the vaccine will prevent you from getting the virus. It will prevent you from getting it.
So if you're already infected and you take the vaccine, you could still test positive.
Absolutely.
But having the vaccine within your system, chances are you will not become fully asymptomatic, and the effect of COVID-19 in your system will not make you as sick as someone who has not been vaccinated. Is that accurate?
Well, so that's a little tricky because timelines are tricky here. So if you've already been infected or if it's already incubating in your system, it takes about 2 weeks for the vaccine to start to make those antibodies that would be protective. So more than likely, if you already had the virus, you'll probably still go through what would have happened if you didn't get the vaccination. Again, because your body didn't have the time to build those antibodies. So the vaccine is not going to treat what's already there, and that's important to know. It's not going to treat what's already there. Not necessarily going to make your symptoms milder for what was already there, but definitely will make your symptoms milder if by chance after the vaccine you're one of the 5% that end up still getting the virus.
Yes, you just segued into what my next question was going to be.
Okay.
The question was going to be after the vaccine, after you've gotten vaccinated, either the first dose or the second dose, and get exposed to COVID. What are the chances of how would your symptoms be? Is it going to be mild? Is it going to be full blown?
Right. So if you got the vaccine, 95% chance that you're not going to have the COVID virus or the infection. You're not the virus is not going to go into your system and actually get into your bloodstreams and infect you. Now, so no, if by chance you're one of the small percentage of people that still end up getting the virus, what happens is your symptoms are a lot milder, and we're trying to prevent death. And so with the vaccine, you're really preventing someone from getting sick enough that they would die. So, so it is preventing death, or even severe COVID symptoms, for people that will get the vaccine, that will get the virus. But keep in mind, I have to keep reiterating this: the very small percentage will get like the full blown infection of the coronavirus after being vaccinated. So just to keep that in mind.
Okay. For someone who has really getting vaccinated and they tested positive, you said chances are they could still spread the virus.
Oh yeah, absolutely. So if you got the vaccine and you tested positive for it, it means that your body is carrying the active virus. So you can still spread it. So again, you know, social distancing, masks, and things like that. And also, just to go back to what I said again, is if you got the vaccination, and even if you didn't have symptoms, or had an infection, there's a difference. So even if you have an infection, you can still carry the virus, particularly in the nostrils, in your fingers and things like that. So stay protected, keep your masks on, and social distance. You're essentially protecting other people who are not vaccinated, who might have medical conditions that make them susceptible to getting infected. You're being responsible by doing that because you're protecting them.
For someone in a situation like that, how can they help the community with contact tracing? Who do they have to inform of their positive test?
So the thing about this is the other part of, is that the CDC has done a great job with making sure that they're in touch with all of the places that get that do the testing. So I'm thankful having tested positive, but some doctor colleagues of mine, said they tested positive and they got a call from their health department or CDC just to check on them and things like that. So even if you didn't report it, the testing centers are reporting, the cases and things like that. It is a responsible thing, though, to just go out of your way, call your health department, of course, your people you work with, and say, I'm positive and things like that. That's a good thing to do, a responsible thing to do. But keep in mind that, just for the protection of the community, the testing sites do report positive cases to
Okay.
the health departments and things like that.
Okay. Should a vaccinated person who tested positive still self-isolate?
Yes. Because you're now producing the actual virus, and that means that your body is carrying it. So if you got vaccinated and you still caught COVID, which again, very small percentage, it's very unlikely that will happen. If it does happen, isolate, quarantine. Wait that 2 weeks and wait for your negative test before you can return back to your normal activities.
Thank you. So how long should a person wait after a positive test before they can get vaccinated if they haven't received either of the doses or if they have received one?
Right. So the thought is that the recommendation is to wait 90 days. And that's because, if you've gotten the virus, your body has gone through a bit of a shock period where it had to work really hard to build antibodies and things that in your immune system to fight the virus. So your body needs some time to recuperate. And so the recommendation is wait about 90 days, give your body immune system a chance to kind of get a breather, catch up, and rebuild itself, and then you can get the vaccine after that.
Okay. And there's these school of thoughts that believes that getting vaccinated is the way for the government to control you. Is that true or false?
Well, I mean, it's false. But again, coming from a doctor and so there are categories of people that have these thoughts of how the vaccine is either the government trying to control or they're putting chips. There are different schools of thoughts out there. A lot of these extreme thoughts are, come from anti-vaxxers, which is not a lot of people. There's a smaller percentage of you that are what they call vaccine hesitant. So they're hesitant because of other issues. Um, Sadly, though, the anti-vaxxers that have these theories, the propaganda is out there and people are worried about it. But no, if you've taken, so this is how I look at it. If you've taken any vaccine, chickenpox, polio, measles, mumps, or whatever, right? Um, you have to kind of think about how these vaccines have been around for a long time. No one really cares about. They're not really checking. If there was a weird, conspiracy theory that the government wanted to control people, I don't think they'll do it through something as obvious as COVID. They probably would try things that people are not looking out for, right? So if you're comfortable taking any of the other vaccines that are still being manufactured, it's not like they're made 20 years ago, and now they're still being manufactured. So if somebody wanted to put something in it, they probably would go with that route. No one's putting anything in anything. These are researchers, these are scientists. The protocol involved and all of that, and it is against even just ethics of the science community to do something like that. Put anything in there that's not disclosed. It won't happen. I promise you, people, it's not happening. It won't happen.
Thank you. I had that same conversation with my mom maybe about a month or so ago about because she came up with this theory too that well this vaccine it happened so fast we don't even know what it was in it. And my response to her was like, remember when we were a kid, you took us to take tetanus, rubella, polio. Do you know what was in those things? She was like, no. I'm like, you should get vaccinated. And what was so funny about it was that 2 weeks later, she tested positive.
She okay?
She's okay now.
Right.
But that's just to let people know this is real.
Mhm.
For the past 2 weeks, she's battling it. Hopefully she's getting better.
Great, great,
She's
great.
recovered, but she's gonna be getting vaccinated, I hope,
Mhm.
after the 90 days.
Mhm. Yeah, she should.
So then there's this line of thought that also says that the government is likely going to use the vaccine to implant chips into your body so that they can monitor where you are, what you're doing, same thing still be under control. How true is that?
So again, whenever you look at the, science community, there are a lot of ethics, a lot of protocol. There's just so much that goes into making a drug, a vaccine, or things like that. The government cannot. I mean, you're talking about thousands of people involved in this process. The government cannot tell that many people to do something and you wouldn't know about it, right? There are no chips whatsoever, nothing of the sort. And you know what? Honestly, if you have a cell phone, that's the chip. You better, if you're not going to get the vaccine, get rid of your cell phone because your cell phone is the chip. They can find you with that cell phone. So don't worry about the vaccine. It's fine, and there aren't any chips anywhere. None.
Exactly. If you have a cell phone, if you have a TV, a smart TV,
Oh,
if you have a computer, you're traceable.
already,
If you have a smart car, you're traceable.
right?
And then there are those, just like I said, who thinks that because the vaccine was developed within a year and it took them a long time to develop vaccination for smallpox, for polio, but because of the rapidity of the development of the COVID-19 vaccine, we should be worried. What do you say to those people?
So, I would say that that's a valid, if you're putting anything in your system and you feel that it's been developed faster than has happened in the past, I think that's a valid concern to have, right? But I'll quell your fears by kind of explaining why it was possible with the mRNA vaccine. When you look traditionally at the process of making vaccines, it can take several years, a decade. Um, Money is usually the rate limiting factor, right? So people have to pump in money and money for allow it to go from phase one to phase two to phase three, and you need money to recruit people to come in. I mean, it's money, money, money. Um, And so those vaccines take time. With COVID, because of its devastating effects, and of course, what has happened in the world, governments, philanthropists, and just a lot of money was donated quickly. So that money limiting factor wasn't there, and money was pumped and pumped and pumped to make this happen. The other thing is this: the vaccines that we've had in the past are a different kind. When I mentioned that, the polio and MMR are, like either the virus that's been killed or part of the virus that's used for vaccine. Um, so those ones take a while. The materials involved, the process of incubating, of getting it, that those just naturally, the scientific process of making those take a while. The mRNA vaccine doesn't need as much of the time factor to make it, to process it. The ingredients and all that are more easily accessible. So that also contributed to why this vaccine was made faster than any other vaccines. And then guess what? We're also in 2021, right? This is the future we spoke about 20, 30 years ago. Science has developed really, really, really fast. So the technologies used back then to develop vaccines are not the technologies used right now. There's just so much more technology available to speed up the process of making a vaccine. So it's a valid concern, but hopefully I've called your concerns to know that even with the speed of it, it is safe. The FDA still made sure that they went through the protocols, and this is one of the largest studies ever for a vaccine. I mean, I think over 50,000 or more people were recruited for the studies. You look at other vaccines from the past, much smaller amount of people are tested and then it's approved. This was just a large number. And when the larger of a sample of people you have to do research on, it gives you more data. And if there aren't any extreme risks involved, then with large data like that, you can approve a vaccine. So I hope I answered the question. So essentially, it's not a concern, but you don't have to be concerned because these are the reasons why it was made that fast.
Yes. And moreover, too, this is the one in the century pandemic.
It is.
Yes, and we, like you said, we are also in a time where we can look at even what we're doing right now.
Mhm.
It wasn't possible 10 years ago.
Absolutely.
The medium from on which we're having this wasn't possible even 3 years ago.
Hmm.
So technology is developing faster than the human brain. I
Hmm.
mean, the average human brain, because there are scientists, technologists, engineers at work that are innovating every single day.
Yeah.
And there are this school of thought who believe that, well, most of the people who are dying from COVID are people with pre existing conditions, older people, but I'm young, I'm strong, I'm virile, so I don't have to get vaccinated because chances are if I catch COVID, I won't die.
Mm.
What will you tell those? What can you say to those people?
Well, so yeah, yes, you're young, and if you catch COVID, and if you're under 65, more than likely you're not going to die. But again, there's a 20% chance that you might become hospitalized, right? Now think about the financial, the just the logistics of healthcare and all that. So you're now an added burden to the health system, right? That burden could have been allotted to someone who really needed an elderly person, somebody with cancer, things like that. So there are things that we do just because of our fiscal responsibility as a human, right? Is say, you know what, I don't want to burden the healthcare system, and you can, God forbid you catch COVID, then you're now someone who can carry it and infect other people. You might not have symptoms. Somebody around you might have symptoms and might end up in hospital. And God forbid, the ultimate has happened to some people, which is death. So again, that's a thought, but if you want to protect others, um, not burden the healthcare system, I would say even if you're young, when the time comes for you to get the vaccination, please go get it.
you. Yeah, can teenagers take the available vaccines?
So we're not yet given teenagers. However, the Moderna vaccine has been approved for 18 and above, and the Pfizer for 16 and above, right? The government is going through a phase of vaccinations. Right now, it's healthcare workers, frontline workers, and the elderly over 65. And then they're going to go phase by phase, eventually go down to teachers and down the line. Eventually, kids above 16 will be able to get it when that time comes, on teenagers above 16. But then teenagers, because technically teenagers start from 13. So
13.
right, under 16 will not be able to get it just yet. Keep in mind, though, that Pfizer and Moderna, they started studies on kids from like 12 and above. They've already recruited, and they're working on these studies. And so the hope is, hopefully by the end of the year, we'll have good data to suggest that younger kids can get it. But I want to keep this in mind. When people hear that younger kids can get it, they just assume it's going to hurt them. No, that's not the reason. The reason is because there isn't research yet to show its efficacy,
Efficacy.
right? Efficacy or even the risk. So we just don't have the research. It doesn't mean that they've done the research and it hurts them. So that's the difference there. So we'll see what happens by the end of the year. Hopefully by then, the kids will get vaccinated too.
Yeah, thank you. I was reading about that yesterday in the New York Times and about all these young teenagers from like 13, 14, 15 who are so eager to be part of these studies. And but the thing is that they have to get the consent of their parents too and the kids. But there are a lot of young people out there who are, submitting themselves to the studies because they want to be part of finding the cure or the prevention of COVID.
That's so sweet.
So
That's sweet. That's so sweet of them. Yeah,
yeah.
so sweet, so sweet. That they're
So
thinking
can
and wanting to be part of a solution is just amazing. Yeah.
they want to be part of the solution? Yeah. So no, the studies are, like you say, are still ongoing. Hopefully, like you said, before the end of the year, they might be available for kids in that, within that age range. So can you enlighten us as to the possible risk with underlying for people with underlying health conditions who may have, relative concern as to receiving the vaccine? Let's say people with underlying high blood pressure, diabetes, obesity, high cholesterol, or any kind of underlying health problems. That it's a what are the associated risk of them taking any of the vaccine?
Absolutely. So the way you think about it is not the risk of getting the vaccine, but the risk of not getting it. In fact, people with or comorbid conditions, meaning there are people that are more likely to get sick from the virus and more likely to die from the virus. And sadly, these are the people who are obese, high blood pressure, diabetes, and things like that. So they are actually the ones that you want to vaccinate so that they don't get COVID, right? And they don't have to worry that that COVID, the vaccine is going to cause them to be sick because they have these conditions. No, not at all. I mean, the response we're seeing from these patients, these people with these conditions, is about the same as the regular population. So so definitely, they can definitely go and get the vaccination. Now, there are people who have cancer that are on immune, leukemia, things like that, that they're on medications that kind of, you know, dampen their immune system and a bit. And the body of doctors, the hematologists, and also the oncologists have looked into that, and they said there's no reason why those patients should not get the vaccine. And again, the same thought is that, if they didn't get it and they caught the virus, then it's worse. They probably would get sick from the virus more than anything happening from the vaccination. So no worries here. In fact, you're the ones that should be ahead if you have high blood pressure, diabetes, any medical condition. You should be ahead in line getting the vaccine so that you don't get infected, because you're more than likely, it's a high probability that you would get sicker if you caught the virus.
Yeah, thank you. And correct me if I'm wrong. In other words, what you're trying to say is that if you have an underlying condition and you get infected, COVID-19 is more highly likely to exacerbate or make worse whatever underlying condition you had before, up to leading to, it could lead to death. So
Absolutely.
your chances of that happening is to get vaccinated so that you don't get infected.
Absolutely. So it's not going to, if you had high cholesterol, it's not going to worsen high cholesterol. But what's happening is when you have high cholesterol, your body is not as your immune system is not as strong as a person who doesn't have high cholesterol, because sadly high cholesterol means that you have your bloodstream, there are things that are happening with the high cholesterol that maybe reduces your blood supply and things like that. So what happens then is that if you get the virus, more than likely you're going to be sicker from the virus. It's not going to necessarily make the condition of diabetes or high cholesterol worse, but it will. It can. There's a higher chance of death. In fact, when you look at the data for people who die from COVID, it is the people with these pre-existing conditions that actually end up dying from it. Another point here is I just thought about diabetes is, again, with COVID, there are people who have actually developed diabetes from COVID. So, it's really not something to joke about. So, they have the infection, it goes and it attacks the part of your organs called the pancreas, which produces insulin. And after COVID, they go from no diabetes to diabetes. So many, many, many reasons why you should go and get the vaccination.
So, what do you say to someone who says, "Well, I'm African American, and with the way the medical studies have been done in this country, I'm aware of what happened to the Tuskegee experiment, where people were intentionally infected with syphilis, only for the doctors to monitor how that disease will progress within the system. And there are others who also believe that people in Africa were infected with the AIDS HIV virus just to see how it progresses. And they're like, you know what, I don't trust the system. I don't want to be subject to be used as a guinea pig to figure out if the vaccine is going to work or not. What do you say to people like that?
Okay, so I've gotten my first vaccine, right? And when I went there, I didn't have to divulge my race or anything, right? Um, there's no selective thing where, you walk in there like, are you such and such race? Then we're going to give you a different. No, it's whatever's there is given to everybody, right? I mean, these concerns are valid because in the past we've had a history of these things happening, and honestly, just the moral failure for American society, and you know, as far as AIDS is concerned, I've heard that argument a lot about how AIDS, came into play in Africa and then Haiti, and people are like, how, could it have been something that was intentionally put there? No evidence to suggest that. No evidence to suggest that. But I understand the concern. Um, so just to let you know, there isn't a batch that they're sending to the African American community to say this batch is going to be experimental. That's not happening. And in fact, if you look at data, I was actually looking at data the other day, and it shows that African American communities are actually a lower percentage of vaccinations are happening there. Now, I don't know if it's happening because people are hesitant, or because they're not sending vaccinations to those communities as much. So that kind of goes against the thought that someone would be trying to do something against the African American community, because there are fewer people vaccinated. But again, could be that people are hesitant, but it could be that is it a possibility that we're not doing what needs to be done to make sure that it gets there's access by the African American community, whether it's providing transportation, whether it's letting them, letting these communities know that it's free. You don't need insurance and things like that. So that's what the data is showing, is that the fewer people in the African American community getting vaccinated. Um, Whatever the reason is, I guess hopefully research will show that with time.
Yeah, that's one of the reasons why we're having this discussion so that we can at least provide information because information is key. There are a lot of people, just because of misinformation or propaganda out there, who have become anti vaxxers, and some of them are even in the medical field.
Mm,
Because in Ohio, for instance, a third of people who work in nursing home have refused the vaccine.
mm,
So, and those are people in the community who are seen as they're seen as authority when it comes to medical stuff or things like this.
mm.
So when you have a lot of misinformation in the community and we the historical lack of trust, that leads to the kind of data that we're having. So
Yeah.
there are some new variations of COVID-19 within, in some were discovered in Britain, others from South Africa. How can people protect themselves from these variants? Can they be protected with the kind of vaccines that we have right now, or the vaccines that we have right now cannot protect you against those?
Absolutely. So keep in mind, viruses mutate, meaning that they change over time. It's just their nature. There have been over 4,000 mutations of the of the virus up until this point. So it's interesting that it's been going on for some time. The reason why the UK variant, the Brazil, and the South Africa variants have been given more attention is because they found that they're more transmissible. More transmissible meaning that they people can easily get infected from it. But studies are not showing yet that they are more deadly or more lethal or cause worse symptoms. No, it just shows that they're easily transmitted. So, if you had like a group of 100 people, if the regular virus would have infected maybe 30 of them, the variants would have infected about 40. So you're infecting more people. When you increase the number of people infected, you're now increasing the number of people that could die from it. So it's not necessarily that they're more deadly, they're more transmissible. So that's the first thing. The question now is, okay, they made the vaccine a while ago before these variants were discovered. Do they work? They've looked at these variants, right? And there's a fancy medical term called epitome. So the way it works is there's a protein around the virus, and that protein around the virus is what your body elicits that immune response to. When they're developing these vaccines, they develop the vaccines to certain what I call like little tentacles on those on the protein, right? So there are all these epitomes on the protein. It turns out that the epitome or the tentacle on the proteins that the variants are producing um, doesn't affect the vaccine. The vaccine can still latch onto the appropriate tentacle, right? So even though there are changes in other things, it can still latch onto the appropriate tentacle to to cause that antibody response that you want to happen. So studies are showing so far that the vaccinations are effective against these variants. And then the other thought, which is still underway, is that if you got the vaccine, your body kind of now recognizes something that's similar. So if these variants came along, if you did get the disease, if it wouldn't be severe, it might be mild or moderate. So overall, more than likely, the vaccinations will protect against these variants.
Yeah. Thank you. Is there anything else you think we should know about the vaccines and how we can go about, uh, getting them?
Yeah, absolutely. I'm going to say one thing, then I'll talk about how we can get them. And that's, there's a lot of concern initially about this mRNA, DNA talk, and people are like, oh, it's going to get into your DNA, and then it's going to sit in there, and it's going to affect your DNA, and then, I don't know, we're going to grow wings or something, or horns, but it turns out that that's not how these vaccinations work. So when you think about an egg, you have an egg, and then you have the yolk in the middle, right? Our cells are think about your cell as the egg and your yolk as something called a nucleus. The nucleus is a very protected part of your cell that has your DNA. The mRNA virus and even the DNA virus that they're giving in the UK, other places, doesn't go anywhere near the nucleus. It stays in what's called the cytoplasm, which is like a little swimming pool of things around the nucleus. That's where the mRNA goes to work to make your body produce these proteins that prevent against the virus. It's not going anywhere near DNA. The mRNA dies after a couple of days. It makes the protein, does its job, it's out of your system, dies. And then your body now builds that immune response to the protein that was developed in your body. So people will say DNA, not going to happen. It's not going to get in your system. You're not going to grow horns, I promise. And then as far as getting the vaccination, I would, call your health department because what will happen is, depending on the state, some states have their phases are going earlier than others. So it might be that if you're a teacher or you have a job that entails with working with a lot with people, you might be next in line to getting it. Right now, it's frontline workers and it's people above 65. But like I said, keep an eye out. Call your health department because eventually they'll start rolling it out for other categories. Currently, about 57 million Americans have been vaccinated, almost 13% of the population, and they're doling out and vaccinating about 1.8 million people a day. So when you think about the population, about 350 in America, 1.8 million a day, hopefully, by the end of the year, we would have gotten, if you all come out, if people get vaccinated, hopefully we'll get to about 70 to 80% of people vaccinated, which is when we'll have something called herd immunity. That is just firm. And that means that 80% of people have exposure to the virus and they have antibodies, will have exposure to the vaccine or virus, have antibodies. And so when there are many people with antibodies, or the virus comes to that person, they're like, okay, this person has antibodies, I can't go there. This one has antibodies. So now the virus has nowhere to go. And so over time, we're going to find that it kind of, when I say dies out, it kind of will become what we say endemic. Fewer people getting it, fewer people dying from it, versus being a pandemic, which is just worldwide death from it. So yeah, definitely encourage everyone to go out there when your time comes. Call your health department. And if anyone is watching this from other parts of the world, the hope is that that other parts of the world will get millions of vaccines, right? So that the whole world is protected, not just America. So some countries are getting rebates, and depending on their economy, so that they can get also the millions and millions of vaccinations they need to develop herd immunity. Because again, it's a pandemic. Pandemic is a worldwide thing, right? So we have to get the whole world to that herd immunity. And until we get to that point, the work is not yet done. So yeah, so
Exactly. Yeah, let me ask you this. Should pregnant women take the vaccine? Is there any side effect, for pregnant women, or
yeah. So
are they okay to take it?
absolutely. So the OBGYN, that's the Obstetrics and Gynecology Association, and the Maternal Fetal Medicine Association, they put out a statement a few weeks ago that said they don't see any reason why a pregnant or a lactating mother can't get it. Now, the issue here again is research. It's all research based. When they did their research, they didn't test pregnant women. They didn't test women that are lactating, but there were people who were part of the research that they tested with antibody, also with the vaccine, and months later they got pregnant. And they're following these people and finding that they're fine. They don't have any issues. So the recommendation is nothing preventing a pregnant mother or lactating mother from getting it at this point.
Thank you, Dr. Ene Ojile, for coming into Legal Angle and for educating us. It's been a very enlightening hour.
You're welcome. So excited to be here. I'm happy to be part of spreading the word, spreading the message, and I have patients. So what I do is I see a lot of patients who I see the worst of what COVID can do, right? So they leave the hospital and then they come to my hospital or Rhea Hospital, and I mean, we see the worst things. I mean, young people who've gotten the virus and essentially look like brain injury patients. It's pretty bad. And when there's a family member sitting on their bedside, and it's always sad to see. But they always say one thing is some of them who've been vaccine hesitant say, look, if I hadn't experienced this firsthand, I would have thought, I'm not sure. But with what they've experienced firsthand from a family member getting it, it is a no. Every single one of them has said it's a no-brainer. They're getting the vaccines when it's their time. So, yeah, it's not a disease to that we can not take seriously. Almost 5,000,000 Americans, 500,000 Americans have died. Because we were at 494 yesterday, which is close to 500,000. That's 500,000 people.
That's half a million people.
So, not something to take lightly. And so, yeah, get the vaccination. Email me if you have any more questions. I'm happy to answer your questions.
Thank you for staying with us and watching or listening to this on the podcast. Until next time, we hope to bring you more wonderful episodes on Legal Angle with Emmanuel the Law Olawale. Until next time, stay safe, get vaccinated, and keep social distancing. Thank you.
Mhm.